Good afternoon. Welcome to Neethus Academy Reading Live with me, Vinod James. How are you all today? All are enjoying? Yes. Doing good with all those things that are there? Yes. Excellent. Really looking forward to welcome all of you for another session. Excellent. Tell me, what are you all up to? How have your day been? Are you all working or are you at leisure, studies all the time? Yes? Excellent. Good. Jinsi George, good afternoon. A very good afternoon to all of you. Neethu Surendran, good afternoon. Very good afternoon to all my lovely students. Durga Yazini. Hi, Jobita, hi. Sorry, good afternoon. Neethu Maria, good afternoon. Rishika, good afternoon. Excellent. Now tell me, how is your studies going? എങ്ങനുണ്ട് നിങ്ങളുടെ പഠിത്തം എന്നാണ് ആദ്യത്തെ ചോദ്യം. How many of you feeling that you're improving on a daily basis? അങ്ങനെ ആരെങ്കിലും ഉണ്ടോ? Improving. ഇല്ല, എവിടെയും മാറ്റം പറ്റിയിട്ടില്ല. Please do let us know how you feel after attending. ഈ ക്ലാസ് അറ്റൻഡ് ചെയ്തതിന് ശേഷം how do you find? And also something about Neethus Academy, we do offer കുറേ ഇങ്ങനത്തെ എക്സാമിൻ്റെ training that we are doing. If you want to get more insights about it, please do not hesitate to contact the number which is there on the screen. They will be happy to assist you. Diana Justin, good afternoon. Vidya, yes, good afternoon. And also thanks for all the number of shares, the likes, the follow, the subscription, all those things. It's all because of you all that we are leading in every aspect. Okay, thanks to all of you. Even if you look into our Telegram page, which you have already pinned, okay, even if you look into that, we are the leader with the number of students who are there in that group. And please be aware, namukku rendu Telegram group. One we have just pinned, the official Neethus Academy Telegram page, and the other one is an exclusive reading Telegram page. Random free ആണ്. പക്ഷേ we accept you only after scrutinizing in the reading Telegram page. Okay, why is that? Because there are a lot of fraudulent people. Surya Anish, good afternoon. അവരിൽ നിന്നും നിങ്ങൾ maximum, we try to avoid. We are not saying that we can avoid all those people 100%. However, we try to reduce it, okay, so that you have an ample amount of place, platform, time, everything to learn. That is our motto, because together we can is what we always say. We can be there for you, we will be there for you, and we are there for you. The only thing is you have to utilize on the aspect of how you make use of us. We can only guide you, we can only tell you, but you have to do. So if you need anything, we are always there, right next to you. That's why we believe in taking you to the next level. We bring that good life to you, be assured. Okay, so in order to do that, our modus operandi will be very different. Okay, so that is there. We have our own strategy, we have our own like trial and error strategy. We have done that with all the students, and we have proven to be effective. And that is the reason why we strictly adhere to certain rules and regulations. Mintu Augustine, good afternoon. Jumisha Anu, good afternoon. Siminibu, good afternoon. Steffi Benny, good afternoon. And so happy to see all those icons which is popping next to your name. If you have not yet liked our page, if you have not yet followed our page, if you have not yet subscribed to our channel, please do not hesitate to do so. Okay, that's the only way that we would know whatever that we are doing for you, you are feeling happy with that. Right. And also please do share the very same link that you're watching onto your social media platform, because your friends, your unknown and known people would only know that these kind of classes are there once you share it. And of course, sharing is caring. Karanam, there are n number of students across the globe who are still unaware that we are doing such kind of free classes. So why not, isn't it? Give it a go. Just please do share if you think that these classes are beneficial. Ria John, good afternoon. Neethu Thomas, good afternoon. Very, very, very good afternoon to all of you. So what are the things that we do? Binsi, Kannur. Okay, fair enough. Good afternoon. Attending for the very first time. There are a few names which are very new to me. If so, please do let me know that you're attending for the first time. It's always a pleasure, privilege to find new people coming on a daily basis. Okay, and to see where they are from. And also it's another thing I can always say, I have known people there. Don't worry, I will not disturb you. But it's just a feeling of happiness inside. Reshmi Liben, good afternoon. Nilda Dominic, good afternoon. Salini Narayanan, good afternoon. So very good morning, good afternoon and good evening to all my lovely students. Right. So I don't see anybody saying that you're attending for the first time. Although, yeah, I know, but I would request all of you to at least start participating by replying. Okay, when the questions are coming on the screen, once I ask you for answers and all, please do reply. Linda Prasannan, good afternoon. Abhinav TR, good afternoon. Very, very, very good afternoon. So you know what exactly, because all of you have saying you have been here, so you know what exactly that we are going to do. And as you can see, Neethu's family offers a lot of exam trainings. So if you want to get insights, please do contact. And we have regular batches as well as crash courses available for the very same thing that you are here for. Okay, if you want, you can see that our next regular batch is only from October, November, December. Ramya Bijanwagi, some first time. Thank you very much, Ramya. May I know where are you from? If it is okay, yeah. Krishna Kripa, good afternoon. So that is how much of trust our students have in us, isn't it? It's an honor to even say that we are so proud about all the students who have given us that privilege to be in that place where it's a proud moment to say that, okay, see, we are only running August and we are full till that time, absolutely because of your trust in us. So couldn't take anything away from you. So you are our patron. Thank you so much for all the students there. And if you feel that you want a detailed, please do join our regular batches. If you know and you have everything in you and you just want a professional advice, please do join our crash course as well. So Geetu Varun, good afternoon. Anaga Annus, good afternoon. I just joined your online course. Okay, fair enough, Ramya. Thank you very much. So all of you who are there in front of me, welcome to another live session. So are you all ready? I'm from Nilambur. Okay, fair enough. I was there and I was just en route to Uti one time and I just got stuck in that place for hours there. Very beautiful place on the aspect of, more of greenery and all those thick plantations and all those things. Good enough. Divya Siju, to thank you, sir. Today my result came. By God's grace, I plus, sir. Your class has helped me. God bless you. Divya Siju, thank you very much for giving us that lovely news. It's all your effort and of course God's grace. It is you who have put in the effort. We are just a bridge. May I know what are your scores, if you could? Okay, so congratulations, Divya. Your dream, you have made it into a reality. So happy for you. From Neethu's family, very, 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 very happy to hear. And all the very best in advance for your dream journey. En route to your dream journey, our prayers will always be there for you. Saumya Bipin, good afternoon. Siminibu, good afternoon. So, like what Divya have just said, it's a morale booster for all of you. Okay. It is like you will also be one day reading 350. Okay, fair enough. Happy to hear that. Okay, Sri Kuti, good afternoon. First time to attend. Fair enough, Sri Kuti. Mano, where are you from as well? See, like what Divya have just said, you will all be able to come and tell in a live session coming and saying, yes, you made your dream a reality. Okay, and all those lovely students who are here for the very first time is all because of your share that you do in the social media platform. So let's go and see what we have in store for you. So are you all ready for today's part B question? If so, give me a very quick thumbs up. Let's see how many of you are ready for today's session. I don't know, it's just to start giving that moral booster on the aspect. See, you have to start telling yourself, okay, I'm here with a purpose. Okay, that purpose is immaterial. My answer is right or wrong. You have to start validating. As what Simi said, ready, Neethu Surendran, ready. Rishika, ready. Nilda, ready. Rosmi, ready. Jinsi George, ready. Excellent. Steffi Benny, ready. Lydia Paul, ready. Very, very good. Neethu Thomas, ready. Jobitha ready, JC Michael ready, Binsi Kanu ready, Neethu Maria ready, Ayana ready, Anu Seben ready, Mintu Augustine ready, Sri Kuti ready, Minu Susan ready, Abhinav ready, Reshmi Libin ready, Ramya Bijan ready. Okay, this is an absolute stunner. Number of ready I'm getting is more compared to Diana Justin is ready. Excellent. So good enough, good enough, good enough. You're all lovely students. Krishna Kripa ready, Atra Prashant ready, Sumi Nimmi, hello, hello Sumi, Ria John ready, Linda Prasannan ready. As you all have said, you're all ready. The question will pop into Laisamma ready, Abhinav ready. So as you are ready, the question will be popping up on the screen. So as soon as the question pops up, do not waste your valuable time. Yeah, just try to finish it before the time finish. Okay, little bit late. There you have the question. Please do the question and then we will discuss. Do not type the answers. Okay, I'll ask you when to type the answer. Now just find the answer. All right, time have eluded all of you. Did you all get an answer? How many of you have got an answer on or before time? All of you have got an answer? Yes? How many of you did get an answer? Silla Alexander, good afternoon. Okay, I could see a few thumbs up popping in. Neethu Surendran, yes. Okay. Benny Sebastian, yes. Jobita Thomas, yes. Cincy George, yes. Okay. Rishika, yes. Sumi, yes. Rosmi, yes. Diana Justin, yes. Neethu Thomas, done. Rajiv Joseph, good afternoon. Linda President, yes. Bincy, yes. Okay, good enough. So all of you have got an answer. Now, because you have all said you have got an answer, may I know what is your answer and where you got that answer? Okay, see, please do not refrain yourself from telling me where you have got that answer. Tina Tojo, good afternoon. Steffi, yes. Rajiv Joseph, yes. Ayana, yes. Ria John, yes. Laisamma, yes. Okay, excellent. Good, good, good. Okay, I love this participation that you're giving. Salini, yes. It's more than what I generally get. A lot of people are saying yes, and all those. Salini Narayanan is the first to say A. Okay, excellent. See, as I mentioned, I want you to tell me where you got that answer from as well. It's not just the answer, where you got that answer from. Yeah? Jin C A from last few lines. Aina, yes. Benny Sebastian C. Okay, so I have an option. Two options are already there, isn't it? A and C. Okay, fair enough. Akila Sham A. Suminimi A. Jinsi George A. Rinuvi Isep C. Sorry, Rinuvi Ipe C. Nitya C. Nilda A. Simi C from middle line. Salini fifth line. Neethu Thomas A. Renu Praveen C. Okay, Rajiv Joseph C. Linda Prasannan C. Lysam Rajesh A. So it's a mix of A and C, isn't it? Equally poised. So yeah. Is there any other answers as well? Vinci A. Neethu Maria C from middle line. Saumya Biban A. Diana Justin A from last few lines. Okay. Krishna Kripa A. Ria John C. Minnu Susan C. Excellent. So it's all on the aspect of whether it is A or it is B, isn't it? So one of these can be the answer, or maybe, who knows, the odd one out. B can be the answer. Let's see. So what are the things that you have to always remember when you're doing a part B is, see, please understand, part B will be given after they take away the part A material. So they will give you part B and C together. And the total time that you are left with is 45 minutes. You have to manage B and C in those stipulated time. There's no separate time and all. Like what we have for part A, you have to manage. The maximum time that you can take to do the 6 questions, which are smaller in part B compared to part C, you have to do it. The maximum that you can take is 2 minutes per question. You can take anything between 10 to 12 minutes. Okay, if it is less, of course, good enough, because you get more time to do part C. Right. So I think I would say most of you have replied. Okay, I'm not saying that all of you have replied. So what you are expected, let's see what are the things that you have, whether it is A or whether it is B or it is C. Jobita C, Danya Vishwan C, Ayana C, Suganya A, Christina A. So now you have the question on the screen. Now let's go and analyze the question. So whenever you are doing a part B, okay, don't read the passage. I'm not saying for any other reason. It's just to manage time. We are time bound, isn't it? So in order not to waste all those, read the question. As you're reading the question, underline the keywords in the question, understand the question. Very, very, very important in part B. So again, I repeat, read the question. As you're reading, underline the keywords in the question. So here, the keywords are, for me, main point of the memo about antiviral drug for children. So main point, antiviral. Okay, drug, let's say. For children and all is okay. It's there, but when you read these two, it's okay for me to understand. See, your keyword underlining should be stipulated to 1 to 2. The main keyword that you will underline, that will give you a clear-cut view about the question. Likewise, even in the answer option, see, you have 2 options after that. You can read the paragraph and then pick an answer. Or if you're like me, I want to know what I'm searching for in the paragraph. So I read my answer option, underline the keywords in the answer options as well. So option A, prescribed guidelines must be followed. So guidelines followed, those are my keywords. The drug of choice is age dependent. Drug age dependent. The incorrect dosage may be toxic. So incorrect, toxic, that is enough. Okay. Now I'm going to read the passage, and as I read, the strategy to do part B is called elimination, because the only type of question is multiple choice questions with 3 options. So elimination, don't read to eliminate. As you are reading, eliminate the answer options and go. So memo, dosage of antiviral drugs for children. Treatment dose recommendations of many antiviral drugs for neonates, infant children are often based on very small cohort study. Now this word cohort, okay, especially it is applicable when you're doing part C. Cohort means something which is of the same kind. Okay, cohort study about let's say AIDS. That means AIDS, those people who are only having or suffering from AIDS would be only looked into that study, not the general public. Okay, that's why that word cohort. Of treated individuals with the considerable changes in renal, hepatic, and gut function during growth and development. The doses are not always adequately optimized, especially those for infants. So now see, drug of choice is age dependent. This age dependent is nowhere mentioned in the paragraph. So it's a straight eliminator so far as I've read. Okay, I'm not saying. So maximizing doses is important for antiviral effect, but this must be balanced with the need to minimize potential toxic effect. See, incorrect dosage may be toxic. They are not saying incorrect dosage may be toxic. They are saying maximizing doses, see, is important for antiviral effect, but this must be balanced with the need to minimize potential toxic effects. So this is there, so you need to give a look into. So it's not saying that incorrect dosage may be toxic. Okay, so it's not mentioned. So again, option C is not for me. Most up-to-date dosing schedules should be used, and if appropriate, so most up-to-date dosage schedules should be used. So they are saying, yeah, there is something which you have to follow, and if appropriate, drug level may also be measured, for example, if needed for acyclovir and ganciclovir. Caution is required in interpreting serum levels of drug that act principally at the intracellular level. Drug level monitoring is also an essential part in the follow-up of combination therapy. Again, see, you have to always look into the drug levels also. For example, in HIV infection, to ensure what? Adherence, safety, and efficacy. So throughout the paragraph, they are only talking about, see, these guidelines must be followed. Why? Most up-to-date dosing schedule should be used. Caution is required. Drug level monitoring is also an essential part, so you should follow that. See, follow-up combination therapy, so you should adhere to it. Okay, marking is not visible. Yeah, I can also see that my marking is not there. Let me check with that. Okay, now can you see the marking? I hope now it is visible, is it? Most up-to-date dosing schedule. Yeah, now is it visible? Good afternoon. Sorry, Madhusmita. It's okay. I hope now it is there. There was some technical, welcome to God's own country, and this internet glitch is always there. Yeah, I'm sorry for that. Okay, thank you. Nilda, thank you. Jovita, thank you. So understood why the answer is A. Sumi is dancing. Keep on dancing. You know, I love those people who enjoy their achievement. Rishika, yes. Binsi, yes. Okay, thank you. Understood why C. See, you have gone for, yeah, they are saying maximizing dose is important for antiviral effect, but this must be balanced with the need to minimize potential toxic effects. So incorrect dosage may be toxic is not what it means. Okay, so you have to maximize it to get this effect. but you have to just be cautious enough. So again, they are saying about following, isn't it? Jinsi George, thank you for that smiley as well. Understood? So this is why A is the only answer which can be got from. And you have to understand, they are asking you what is the main point. Is maximizing, let's say, toxic effect also. Is it the main point? It's not. See, that is why I told you main point is my keyword. Neethu Thomas, thank you. Clear? So people who have got A, absolutely good enough. The way that you looked into is good. People who have got C, no problem. You just went behind without looking into the question. Main point. So throughout the paragraph, they're saying, please do follow this. Okay? Clear? Any doubts? Mintu Augustine. Yes, Linda. Yes. Any doubts? Anything that you're not... Nelda, clear? Okay, thank you very much. Excellent. So as you have said, clear. No doubts, no? Right. Because you said clear and no doubt, let's go and quickly see our... Which one? Part A. So what is today's part A? The most important thing for Neethu's family is how you felt about today's part A. Give me a very quick insight on the aspect of what is today's part A and how you felt about today's part A. That how is very, very, very important for us. Why? You are our patrons and we always are obliged to you on the aspect because of what you say, how you say, what makes you better. We mold our strategy. So what? Clear? Tina clear? Binsi clear? Benny clear? Lissama clear? Surya no sir? Krishna Kripa clear? Ria clear? Okay, fair enough. What is today's part A and how you felt about today's part A? That how is very important for me. Because Neethu madam will be really looking into on the aspect of what all are the comments that you're posting, because with that comment, she will frame the next material for you. Please include part C. See, part C, as of now, see, our students also should need some privileges, isn't it? So that's the only reason. Tough material, jo bhi tha, okay. Polymyalgia rheumatica, tough material. Merlin Sebastian, how you felt about the material? That how is important. Clear, Neethu? Okay, fair enough. Merlin difficult, okay, fair enough. So, Neethu madam, I've just listened to your thing, isn't it? For the past few days, tricky, easy, tricky, a bit tough now, difficult, because those students who have told, 2 people have said that it is difficult. How about others? Did you all feel it is difficult? Yes? Did you? Easy material, Rishika. Okay, there you have. So, again, it's all subjective. Everything that we do, everything that happens to us, it depends on our exposure and all those things. Okay, fair enough. Mintu clear. Krishna Kripa. Renu VIP is also saying difficult. So generally it's on the difficult side, is it? Let's see. Now we'll have the material on the screen and then we will see. Little bit tough, Madhusmita. Okay. Excellent. So you should always, isn't it? I'm a person who always believe when the going gets tough, the tough gets going. Let's see. Now you said, so overall perspective, as you are saying, it is a bit challenging. How many of you feel that you will get 20 out of 20? How many of you feel that you will get 20 out of 20? Now you have the material on the screen. Now what is the strategy? Part A is what your reading starts with. Okay. Just be confident enough. Okay. One, it's quite challenging. What are the reasons that makes part A challenging is, one, you only have 15 minutes of time, of which you have to tackle 20 questions. Isn't it? That's quite challenging. On top of that, or let's say if you really break it down into seconds, you have 45 seconds per question. Yeah. And in those 45 seconds, you have to tackle. So it's not that it goes very quickly, especially on the day of exam. Now, what are the things? Strategy for part A is called skimming and scanning. Skimming means quick look, scanning means detailed look. Now, how much of time can we take to skim? The maximum time that you can take to skim the 4 text is 1 to 2 minutes. That means 15 seconds per text. Clear? So these are the things that you have to really look for. And adding on to this misery, you have 3 types of question. That means 1 to 7 type of question are called match the following, where your answer options can be A, B, C, D. This should be by hearted. 8 to 14 are called short answer question, where your answers can be word, numbers, combination of word and number, and a short phrase. 15 to 20 are called fill in the blanks, where the same instruction. Here you have to be a bit more cautious on the aspect of repetition of articles. Even if your article is repeated, your answer goes wrong. It's called redundancy. So this makes part A a bit more challenging. Now, what are the things? When you're doing skimming, you're going to underline the keywords. See, that is very important. You're underlining keywords. So what are the keywords? Just to give you a very quick insight, keywords are headings, subheadings, letters given in bold letters and italics, numbers, abbreviated form, bulleted form, proper noun, any new terminology that you're encountering for the very first time, and a pictorial representation, your X and Y axis, heading. So I told you keywords are heading. So yeah, PMR is a condition that causes pain, stiffness, inflammation in the muscle, shoulder, neck, hip. Poly means that, word means myalgia. Polymyalgia rheumatica is a high risk of getting conditional called GHCA, and this is a low blood vessel called arteries. Main symptom muscle stiffness in the morning 45 minutes, and cause symptoms include high temperature, fatigue, appetite, weight loss, depression. UK 1201 every year. So likewise, okay, I just got a general insight about text A. Now when you're skimming, you should know, okay, this is what it is. UK 1201 and 1200 symptoms are there. So this is more prominent in muscle stiffness and all those things. And after that, cause of thing is unknown. But what are they saying? Genetics are there, environmental exposure are there. So risk factors again, so they are talking about cause and risks. So risk factor, age, sex, race. So 70 to 80, these are all supposed to be your keyword. Now, doctor might recommend. So what is this? Recommendations. Who recommends? Doctor. So these are something which they are going to use for diagnosis. Blood test, imaging test, doctor suspect, and all those things again. Now see table. This is a table, isn't it? So table headings are important. Event dose specification. Some part is missing, although. So 2015. So oral prednisone, intramuscular methylprednisolone, methotrexate. So there are a lot of other important things, but oral prednisone, methotrexate, all those things. Of course, you can go with the keywords and all. Now I know, okay, medicine and all, they're in text D. Anything about the diagnosis or methods, text C. C is about the way that you see the causes and risk. A is general. Now after this, you're going to go to the question. Instruction, I told you, you have to by heart it. You're not supposed to waste your valuable time on the day of exam or when you're practicing. You can't keep on wasting your valuable time because we are running short of time. How do we administer initial management? Methotrexate. So methotrexate where? Do you really need to worry about? I am not going to worry because I just read that methotrexate in D only. I'm writing D. Now how do we administer? To be very precise, methotrexate, why? It is there only in D. No, do we really need to worry? Initial therapy is given like this. Not needed. Okay. So which is considered to be predominant indicator? So indicator where? I know that I read it in A. Now let's see. Where are the predominant indicators mentioned? It is as such mentioned in A. Why? the main symptoms, isn't it? Muscle stiffness. So predominant indicators is A. Common test. Do you really need? Where are the tests available? It is there in C, isn't it? Between polymyalgia and other conditions. So now just to get it clarified, okay, I'm just saying, see, what are those? Distinguish polymyalgia from other condition causing similar. Which one? Imaging test. So it is there. Definition title. I know that word poly and myalgia and all is there in A. There is nowhere else. I know that. Why? If you want, here. Isn't it? Do not waste your valuable time. This is how you have to be more precise when you're doing. Instances demand application reduction strategy. So where are they talking about all these reduction strategies, implications and all those dose and all? Dose is as such mentioned in there. Now see, there are two places where you get, isn't it, throughout. Here are all saying about all these reduction strategies. Okay, so the answer comes from lower doses, adverse effects, and then again they are saying strategies might be applied, not feasible, dose reduction. So all these places very specific. So the answer is D. One aspects vulnerable. So what makes these people vulnerable? I know it should be there in science, isn't it? Do you really need to worry? Why? Because certain genes and gene variation might increase your susceptibility. So what is the factor? The answer is B. Ethnicity. Ethnicity is only in one place. Why? It is there in B because it clearly says race. Understood? So I manage my time. Next one is 8 to 14. As I'm going into 8 to 14, please be kind enough to tell me how much you have got in the first 7. So answer is, as I mentioned, it can be a word, short phrase, numbers, or a combination of both. This is how your keyword should be and your answer should be. So medication, extended period of time, polymyalgia rheumatica. So do you really need to worry about? Medication means go straight to D. Now which one is the next keyword? The next keyword is maximum duration. Maximum duration where? Greater than or equal to 48 weeks, because here it's 4 week, 8 week. Anywhere else? So maximum duration, what is the medication used? Intramuscular methylprednisone. So that is the answer. INTRAMUSCULAR METHYPREDNISONE. Excellent. I could see a lot of 7 out of 7. Absolutely good enough. Keep it up. Now question 9. Condition likely to be developed. So condition likely to be developed. Where are they talking about? What can you get? So clearly if you have polymyalgia, you are at a higher risk of getting a condition called giant cell arteritis. So or the safest bet is GCA. Why? Because the abbreviation is given in the text. Clear? Excellent. Question 10. Imaging test. Imaging test means go straight to C, isn't it? Imaging test is only mentioned there. Uneasiness in joints. So where are they talking about imaging test? It is clearly said MRI can also identify other causes of your shoulder pain such as joint changes. So what is the imaging test? MRI is the answer. Ultrasound? No. Which drug? Symptoms by 70%. So 70%, which drug? So drug is there. Where? It's already there. Now the next thing is 70%. So 70% is mentioned here. So which is the drug? The drug is oral prednisone. So the drug should be ORAL PREDNISONE is the answer. Excellent. Question 12. Where cases more often? So where are these cases more often? It is there in the UK, isn't it? So the answer is UK. Very simple. From text A, of course. That's the only place where a country is mentioned. Technique to remove small portion artery. Examine for the inflammation. So technique, what is the technique? The way that you are taken for something. So what is the technique saying? If a doctor suspects that you have giant cell arteritis, he or she are likely to order a biopsy for the artery of one of your temples. So what is the technique that is used for to sample small sample? The answer is biopsy. You can write with or without the article is fine. A biopsy or biopsy. Common range of age where people are more prone to be attacked. So range of age means they should have a starting point and an end point, isn't it? So what is that starting point and end point? The starting point and end point is given only in text B. Why? It is clearly said 70 and 80. So the age is also mentioned. So the answer should be 70 and 80. That's the range, 70 and 80. Excellent. Good enough. So that wraps up 8 to 14. Now for the final stint, these are called fill in the blanks. The instruction remains the same as I've mentioned. Word, short phrase, numbers, both. All are there. Here, an article or any word. See, let's say off is here, okay? And you are writing again of something. So when you read, what happened? Whenever there is a problem or non-availability of, this is what that mistake is. Because fill in the blanks means you are expected to fill what is missing only. Be aware of it. Yeah? Good. Along the said rate, doctor will also look for indicator called to determine condition. So said rate, determine condition. So where are they talking about? It should be there in some diagnosis, isn't it? So what is that? The doctor will use said is what? Besides checking your complete blood count, your doctor will look for two indicators: erythrocyte sedimental rates and C-reactive protein. So the answer is C-reactive protein. Two-word answer. It is a hyphenated word, so please ensure that you're writing it with hyphen. Whenever problem non-availability, reduce doses, instigated means applied. Okay, so that means where are they talking about? So it should be somewhere in the dose. When you say dose, it should be somewhere in D, isn't it? So what are they? In case 1 mg tablets not available, 1 mg reductions are not feasible, similar doses reduction strategies might be applied. So what is that? 1 mg tablets or non-availability. So the problem or non-availability. So it is only asking you about non-availability. So the answer is 1 mg tablets is non-available, isn't it? If you really look into the next one, what is that? It is not feasible. Understood? So that is why 1 mg tablets. Question 17. Ecological trigger, utmost role, generation, polymyalgia rheumatica. So environmental, so it should be there somewhere with the risk, somewhere. So where are they talking? Environmental is as such there. So what is that? This suggests that environmental triggers such as virus. Do you really need to write a virus? Because A is already given in the question. So your answer should be only virus. Dash that lasts for more than 3/4 of an hour. So 3/4 of an hour. An hour, see, for example, an hour is of 4/4. 15, 30, 45, 1. So 3/4 means 45. Understood? So 3/4, where are they mentioning about 3/4? It is as such mentioned in A, isn't it? See, if the muscle stiffness is more than 45 minutes, so 3/4 of an hour. So the answer is muscle stiffness. MUSCLE STIFFNESS. Excellent. The penultimate question today. Follow-up drug 7.5 10 mg. Drug 7.5 10 mg. I can straight away go to 7.5 10 mg. 7.5 10 mg. Now next keyword. Considered if there are relapse. So relapse is only for initial therapy. So the answer is which one? Which is the drug is the question, isn't it? So follow-up is there, initial therapy is there, but the drug is methotrexate. methotrexate is the answer. The ultimate question for today. Arteries are the dash, swelling, GCA. So where? GCA, arteries and all. So the answer is, should be in A, isn't it? GCA is here. This involves inflammation of the blood vessels. So the answer is blood vessels. BLOODVESSELS. I have fired my 20. Now it is your time. If you have any doubts, please do clarify. If not, do fire me the total scores. Blood vessel or blood vessels is the question. Bijo. In the text it is blood vessels. So arteries are the 17 jo beta, excellent, good enough. 19 Bijol, very good. Rosmi 18, very, very good. Blood vessels, Rishika, I've already told you. See, blood vessels are two words. Okay, I know that it is a typo, but just reminding. Merlin 16, excellent, good enough, good enough. Jinsi Jobi 18, very, very, very good. Rishika 19, absolutely good enough. Rinovia 16, Vidya Ranjit 16, good enough, good enough. Susan 17, okay, good enough, excellent. See, you should be proud about your achievement, isn't it? Daksha 18, a new name. Tina 17, Neethu Thomas 17. See, you said it is a bit challenging. So in a challenging perspective, you say, okay, in a challenging one, I'm still able to get 16, 17, 18, 19. Absolutely good enough. Madhusmita Bear 19, very, very good. Any general doubts that you want me to clarify? Krishna Kripa 16. So since you don't have any doubts, okay, it's high time that I will also say on behalf of Neethu's family, adios from all of us. God bless you all. Take care. See you tomorrow. Bye.